open 24/7, but
Yeah.
the hours are not exactly that. So what work is being done, and what are your...
Do you want me to comment on it first?
Yeah.
Yeah, I think, first and foremost, what started as a pilot project, and I spoke earlier to the access point for mental health and addictions care in that facility, and the importance of having those access points as we increase that provincial capacity. But I'll speak now to the urgent care side, and what started as a pilot project, and I think can be regarded as a very successful pilot project in providing the opportunity for people to access a medical health care professional in an urgent care scenario. So maybe not something that requires an emergency room care, but something that is more urgent than waiting 7 or 10 days to see your family physician in a primary care setting. And the urgent care is proving to be very valuable in that space. The volumes are proving out to be that, as they are, the urgent care volumes on a daily basis are coming close to actually what is being seen by either of the hospitals in Regina. And so significant volumes coming through in the 16 hours that are there. What we've asked the Health Authority to do in the Ministry of Health is to, look at where and when those volumes are peaking, and how can the urgent care center be of the greatest assistance in providing that access to a primary health care provider, whether it be for stitches, an x-ray, or even something more minor. Should it be concluded that those 16 hours are sufficient, and what we need to do actually is add a second urgent care center in that space, that might be the path forward. Should it be concluded that it should be open 24 hours, and in those other few hours there is enough need that it just simply can't be closed for those hours, then we would consider that as well. And so I think as this started as a pilot project, a highly successful pilot project in the number of people that it's seeing in the urgent care space. We are looking more at replicating it, not only another centre or location in Regina, but expanding to Saskatoon, North Battleford, Prince Albert, and Moose Jaw. We might find that those 16 hours are the hours of the day where there's the most need, and in an environment where we're continuing to work very hard to attract healthcare professionals of all types and all designations, is to have them working together in the team-based care that they have, seeing the highest number of patients that they have, and preserving that capacity across the system. So I think there's maybe some decisions that will be made in the time ahead, but they'll be made in consultation with some of the data that the Saskatchewan Health Authority has, the Ministry of Health, and others.